Okay, good morning, everybody. I'm Dr. Kiat, clinical toxicologist, St. Luke's Medical Center here in Quezon City and in Global City. We will be talking to you this morning about the common poisons in our home. Okay. Videos and the slide is not moving. Okay. Sorry for the technical glitch. Okay. Again, there is a technical glitch. Another technical glitch. Okay. Now, for the common household poisons, one of the common cases that we really get is the accidental ingestion of kerosene or alcohols, either ethanol, the alcohol that present in our alcoholic beverages, and isopropanol or isopropyl alcohol. The one that we have in our here. Okay, we used to disinfect our hands more often today because of our current situations. Okay. Yeah. Ulitin ko ano. Bakit ayaw niya mag-move itong slide? Oh, ayaw niyang, what do you call this, umatras and everything. Ayaw niyang unmute and start the video. Okay. Going back, I think this slide was, I can't hear my voice. Now, the most common household poisons stored in our house, in our home, number one is kerosene. We get these cases a lot, especially accidental ingestion in children. They are usually placed in a container of soda or bottled water, and it looks like water though. Okay, it's white. No, it's colorless, clear. Okay. Number two is your alcohol, which is present in every household nowadays because of our current situations. Your ethanol is the common alcohol contained in our alcoholic beverages, and your isopropyl alcohol, which is present in our disinfectants or antiseptics currently that's oftenly used nowadays. Okay. Now, we also have the cleaning agents, one of which is your silver or jewelry cleaner or gold cleaner, which is one of the most dangerous cleaning agents ever made. It used to clean your jewelries. It contains acid and the most dreaded cyanide. And the other one is your alkalis, or your most commonly known as bleach, your sodium hypochlorite. Okay. Again, it's one of the most sought after cleaning agents in the market today. Now, for pain or fever, your paracetamol, marketed as, for mild to moderate pain, and your sedative hypnotics, which is commonly your benzodiazepines. Example of which is your what you call this, Valiums, Rivotril, and mostly they use it as a sleeping aid. Now, the other substances that we usually store in our houses are your pesticides, especially during this rainy season, okay, or even summer. We have lots of cockroaches, mosquitoes, and other insects, and even during this rainy season, of course, we have these rats. So others, they store rodenticides or rat poisons in their houses. Okay. Now, of course, this is not really common, but given our drug problem today, others, they just, I get cases from time to time, accidental ingestion or mostly ingestion of methamphetamine, or commonly known as shabu. It's lying around inside the house, usually from, drug dependence, parents. Usually, accidental ingestion, usually done by kids of drug dependence. Now, let's talk a little bit more about kerosene, okay, which is the most commonly stored chemical in our house. It's used for lighting up charcoals or any. Sometimes they use it as a cleaning agent. Okay. Now, if accidentally ingested, and it's the most cases we've seen are accidental ingestion by kids. Okay. Even in our poison center, this is still number one in calls and in admissions in children, accidental ingestion of kerosene. Usually, the signs and symptoms, what you will see in children, they started, because of the taste, they start sudden onset of diarrhea, of what do you call this, vomiting, okay, nausea, or sometimes chest pain and difficulty of breathing. And if accidentally spilled into the eye, can cause significant eye irritation. Okay. Now, what to do at home? Okay. If the kid accidentally ingested it, the first thing that you will do, if the kid started to vomit or vomited already, remove the clothing. Okay. You wash the exposed areas with soap and water, and please, again, please do not induce vomiting, because this chemical can cause loss of consciousness or impairment of consciousness. And when you induce vomiting in a person with impaired consciousness, there's a big chance that the vomitus, or those the food or the chemical that should have been expelled to the mouth will go to the lungs. Okay. The best thing to do after decontaminating the patient, like change of clothes, like washing the exposed areas, is bring the patient or the victim to the nearest hospital. Okay. Now, next is our bleach, the common bleach. Okay. The active ingredient is sodium hypochlorite. It's almost the same as kerosene. Okay. But unfortunately, this sodium hypochlorite, or the common bleach, it comes in a different form. There are brands that have scent, okay, floral or lemon scent, and others, they try to probably they thought that to mask the taste, they try for deliberate ingestion, they try the color safe, but it doesn't make any difference. Okay. The signs and symptoms still, again, skin or eye irritation. If it's accidentally gets into your eye, of course, it's throat pain because it's a caustic material. Okay, so you have difficulty of swallowing, difficulty of breathing, and most common that you will see is vomiting. And of course, there's also abdominal pain. And most patients, and if you see this, there's a chance that because this is caustic material, there's a chance that there will be some degree of injury in your stomach or esophagus or even in your intestine. Now, what to do at home? Again, do not induce vomiting. Okay, if within 30 minutes of ingestion for adults, okay, look, it's egg white. Okay, egg white. You have to separate the egg white from the yolk. So for adults, you need 8 to 12 eggs, and for children, 4 to 6 eggs. Why? Because you need to cover or coat the stomach against this caustic material. And what if you don't have eggs? And then the thing here is Filipinos, okay? I get this question a lot. They usually give milk or water, okay, as a neutralizing agent. So, will it be dangerous to give what do you call this neutralizing agent, milk or water? Now, try mixing your caustic, your bleach at home with water, and you will notice that there are some smoke, small amount of smoke coming up, will come out if you mix water, and it's kind of, the temperature is kind of hot. Okay, it's warm. This is called exothermic reaction. Okay, you don't want that happening inside your stomach. Okay, it will significantly exert more damage. Okay, for the best thing that you will do, again, wash the exposed eyes or skin, change of clothing, decontaminate the patient, wash with soap and water, and bring the patient to the nearest hospital. Okay. Currently, for patients, I get a lot of patients taking this, deliberately taking this caustic material, because it's just like your isopropyl alcohol. I think it's present in every household today. Now, what about the other caustic agents in our house? Your liquid sosa, or your sodium hydroxide, or and acids like your hydrochloric acids, the toilet bowl cleaners, and carburetor fluids. Liquid sosa, as we all know, is a very, very powerful caustic. Even a drop in your lip can cause significant swelling. And you can just imagine if one ingested this. Okay, we had several experience in kids accidentally ingesting this, and the outcome is not really good. When I say it's not really good, it's super bad. Okay, just the same with acids, like your muriatic acid, and we usually use this to clean our toilet bowls. We mix it with water, or we use it purely. Please, if you use this, okay, and you mix it with water, mix it outside, not inside, because the fumes that will be generated if you mix water and hydrochloric acid or muriatic acid can significantly damage your eyes and your lungs if you inhale it. Do it outside, okay? Now, what about this, the pesticides, okay? When you say pesticides, it's insecticide. When you say insecticide, it's for insects, okay? And for rats, you have your rodenticides, okay? So the common ingredients of our insecticides in the market today, the so-called pyrethroids, or your cyflutrin, transflutrin, cypermethrin, etc. And if you notice also, there are two types. You have your water-based and your original. In the original form, you will smell it, right? It's like, they call it, amoy gas. It smells like kerosene because of your petroleum distillate. What about the water-based? You cannot smell it because it's alcohol-based. It's water-based, okay? So those are the differences. Now, what if you're exposed to pesticide? Let's say via spray, okay? Most common symptoms there, if you have an asthma, chances are it will be triggered, okay? Or any form of also there will be some degree of allergic reactions like a runny nose. Others will have rashes, and others will have difficulty of breathing in an extreme situation. Very sensitive, or if taken deliberately, there will be weakness, convulsions. Okay. Then, and what to do? Again, if you notice, as a standard decontaminating procedure, you have to remove all the clothing. Okay. When I say remove all the clothing, including the jewelries, if they have dentures, take out. Remove also the dentures. Bathe with alkaline soap or any form of soap and water. Do not use or do not scrub the patient. It's just water and soap. And bring the patient to the nearest hospital for evaluation. Okay. Now, before I proceed, we would like to invite you to like and subscribe our Facebook page and our YouTube channel. Okay. Now, what about the other pesticides at home aside from the spray? Oh, they're very they become very innovative. You have your chalks for cockroaches, mosquito coils, commonly called as what? Katol. Okay. Plug-in repellents and rodenticide pellets or baits. Okay. It contains the so-called coumarin and other derivatives. Okay. And I'm just a little curious, why these pellets and baits for rodents or rats? It comes with what do you call this? Beautiful colors. You have baby blue, you have pink, and if you put that somewhere and you have a kid who's playing on the floor, the color is attractive. Okay, there's a chance that this child will take it and put it in the mouth and swallow it. Now, remember, children have increased hand-to-mouth activities, meaning what they can get hold on what they see in the floor or anywhere else, they're usually very curious and put it in their mouth. Okay, so that's why we tend to clean our floors really well, so we can so our kids or the child can play in the floor. But unfortunately, uh, some accidents do happen, especially when you place these rodenticides or pellets or baits uh, somewhere that's accessible to the child. I've handled cases like this. Now, for our common rubbing alcohol, okay, the active ingredient is your isopropyl alcohol. Okay, the if you accidentally ingest it or deliberately ingest it, it's just like the signs and symptoms is just like alcohol intoxication from your alcoholic beverages. You have your weakness, vomiting, okay, palpitations, and of course drowsiness. And sometimes if you take it in excessive amount, especially by kids, uh, there will be a profound uh, impairment of consciousness. Okay. Now, what to do at home? Okay. Because in excessive ingestion, especially for kids, this will bring down the temperature. Do not induce vomiting because this substance can impair your consciousness. Okay. Bring the patient to the nearest hospital as soon as possible. Now, like what I've said earlier, okay, for this silver or gold jewelry cleaner, the dreaded ingredient is your cyanide, because this thing comes in a like, what do you call this? It's just like a block of sugar. Okay, you dissolve it in water. After dissolving it in water, it looks just like water. Okay, I've managed patients, especially kids and even adults who intentionally ingested this. Uh, it's not a pretty sight. Okay, it's cyanide. Now there are three poisons that have a very rapid knockdown effect: your hydrogen sulfide, your carbon monoxide, and your cyanide. Okay, cyanide, time is really of the essence here. The time, because you need to administer the antidote. Okay, and the antidote is not readily available in any other hospitals. Okay, now for accidental ingestions like this or intentional ingestions, of course, because it's cyanide, there will be loss of consciousness. But it all really depends on how much you took in. Okay, you have your palpitations, difficulty of breathing, bluish discoloration of lips and skin, meaning the oxygen circulating in your body is really low, headache, dizziness, okay, because of its, and if you notice, it also has sodium hydroxide, just like what you see in, what we see in liquid sosa. It can cause vomiting and gastrointestinal damage. In extreme situations, you can go into convulsions or seizures. Okay. Now, what to do? It's pretty much the same. Okay. Remove exposed clothing, wash exposed areas. But then again, like what I've said, time is of the essence here. Okay. If this thing will take you about minutes to do it, everything, rather just rush to the hospital. Okay. And then inside that hospital, decontamination process will be done. Now, what about pharmaceuticals? Okay. Uh, most common, is your, paracetamol, ferrous sulfate, aspirin, and others. For kids, multivitamins. And what are the dangers of multivitamins, by the way? Most of our medications for children, we usually store it in the refrigerator, right? And actually, kids can really access it. How many houses nowadays have their own medicine cabinets with locks? Okay, so I think it's not that common because most medicines are being stored in the refrigerator. Okay, so these medicines, as long as it's on direct sunlight, you can maintain its potency. Okay, you don't need to really refrigerate it. Okay, for paracetamol, and before giving this, you have to make sure that you have to follow the instructions of the physicians on how to give it, because I have lots of cases, paracetamol poisoning in kids because of they presume and they didn't clear it up with their physician on how to really give it, and eventually they overdose the kid. Okay, and by the way, you can ask your questions in the chat box. Okay, I will answer them as much as I could. Okay, now if you have cases like this, paracetamol poisoning and the other pharmaceuticals, it's best not to presume or assume that this is nothing, because for paracetamol itself, there is a delayed poisoning, the delayed manifestations for this one. Okay, even for a simple ferrous sulfate or iron preparation. Okay, sometimes you don't see it right away. Okay, now what do we expect when we bring the patient to the hospital? Okay, of course, in the hospital, the first thing that they will do is stabilize the patient. They have to make sure that the patient is stable upon arrival. And it's hard to presume that this is nothing, okay, even if the patient is conversant, etc. Okay, they have to check for the airway, the breathing, the circulation, okay, and then check on these and ask the relatives or any informant about the history, what has been taken. Okay. Now, of course, even if you decontaminate the patient at home, another decontamination will be done in the hospital. Okay, if there is a possibility of splash in the eye, you will expect an irrigation of the eyes, and if there is significant ingestion of a certain pharmaceutical substances or any other chemicals that needs to be removed, we expect insertion of a nasogastric tube or a tube inserted in the nose going to the stomach, and sometimes we just aspirate on what's inside or given activated charcoal. And activated charcoal is a special kind of charcoal. This charcoal absorb, meaning it binds the poison that's present in the stomach. Okay, and after that we give cathartics to help it to eliminate it more faster. Okay. Now, administration of antidote. Okay, is activated charcoal the universal antidote? Well, it could be. This activated charcoal is best given if you get the patient really early, probably within an hour or two, it's better. Okay. So what about sodium sulfate as a cathartic or a laxative that will help eliminate the charcoal with the substance bound to them? Okay. If it's available, we give sodium sulfate or the polyethylene glycol. Now, other antidotes that may be given, we will probably, not all hospitals have this, okay? We have your N-acetylcysteine, deferoxamine for iron poisoning. This one is the sodium nitrite and sodium thiosulfate. As far as I know, there's only one hospital that has it, the Philippine General Hospital. Other hospitals, we don't have stocks of this one. But for in our institution, only sodium nitrite and sodium thiosulfate for cyanide is not available. All of these other antidotes are available. We have a very capable emergency room doctors in our institution. Of course, you will also expect blood works, okay? Urine tests, radiologic tests or x-rays, and probably special procedures like your endoscopy if there's an ingestion of caustic materials, just to make sure that your gastrointestinal tract is not significantly damaged. Okay. Well, there will be at least a 24-hour observation, or probably less. It really depends. It really depends. Okay. So as a toxicologist, sometimes my patients, there will be a less than 24-hour observation. Okay? It really depends. Okay. The patients need to be assessed. Like what I've said, our emergency room doctors and consultants are very much capable in assessing the patients. And of course, with my including also my opinion about this case, if I see the patients, or it will be referred to me via telephone call. Okay. If there's intentional ingestion, this patient will be referred to, of course, psychiatry. It's not. It doesn't mean that when you refer a patient to psychiatrist, always requires medications. No. Okay, it's just something that that this patient need to be evaluated or assessed for a possibility of what really happened and how did he or she ended up taking this intentionally. And for kids, okay, the patient will also be referred to child protection unit if okay, there's a evidence of neglect. And of course, and in children, there's a lot of accidental ingestion too, because as what we commonly hear from parents is the word akala ko. Okay, so and I usually say, marami hong nadidisgrasya sa akala ko. So you better be sure. Okay. Now, for safety precautions, identify the substance in the house that can cause poisoning. Okay. If it's potentially toxic, okay, separate it. Okay. And if they are not being in use, throw it away. Okay. Don't store it. Okay. And check also your pharmaceuticals. Check for the expiration dates and everything. So I would like to reiterate, okay, that any substance can be a poison if taken in excessive amount. Okay, children are usually on the floor, they play in the floor, and please do not, again, I will emphasize, do not store dangerous chemicals that can be reached by kids. Okay, put in a place, put it in a put it somewhere that's not accessible to children. Okay, I I really sometimes uh, it's actually very frustrating to treat kids for accidental poisoning. It's completely preventable, but again, you know, we don't live in a perfect world. That's why we have this lectures and everything to educate parents and other household members on what to do. Okay, do not store poisonous substances together with food or drink. Okay, let's say, for example, my cases before accidental ingestion of your jewelry cleaner. It's just like poison. It's just like water. They just leave it in the dining table, or others just put it in the ref in a bottled water container, and just someone just open it and drink it. There you go. Okay. Kerosene, usually stored in a soda bottle or bottled water container. Again, and if you notice kerosene, it looks like water though, right? So better separate and better be aware than be sorry later. Okay. Now, if you can teach your children to recognize poisonous substances that are not to be eaten or taken, that's better, because do not underestimate children. They are very, very intelligent. Okay. Now, children should be supervised by adult all the time. Do not just leave them. Okay. Usually, what do we usually hear? Nalingat lang po ako. Okay. That's when it all starts. Okay. Do's and don'ts in case of poisoning: remove all contaminated objects in the body, jewelry, like rings, etc. Like what I've said, if you can bring the patient to the hospital, if there's something in the body, just remove it, leave it at home, and then bring the patient to the hospital. Okay, I cannot. More often than not, we panic. Okay, people panic and everything because of what happened, but better to remain calm and focus and do this than panic at all, because instead of helping, it will probably a little bit more disadvantageous to the patient. Okay. Again, like what with this I talked earlier, decontaminate the patient. Soap and water only. Do not scrub the patient. Okay, do not destroy the integrity of the skin, especially if the poison is in the skin. If you scrub it, there's a chance that you the protective barrier of the skin will be damaged, and the poison will be absorbed more. Okay. Do not give victims of poisons antidotes that we don't know. Milk, water, vegetable oils, or coconut milk water, or oil. Okay, sometimes other poisons are better absorbed if given with oily substances. Okay, please don't. Okay, just bring the patient to the hospital as soon as you can. Okay. We do not, again, do not induce vomiting. Okay. The reason for this is they may aspirate the stomach contents and may cause more injury. Okay, especially on the lungs. Okay. Take the victim, to the patient or the victim to the nearest hospitals. Okay. And how I wish that, we have a perfect setup, just like in any other country, that, we can really call an ambulance and we expect rapid response right away. And I think we're getting there, but most of us have cars and probably live in proximity to hospitals, and we have a better access now. Okay. For better identification, bring the poisonous substances, the substance or the container. Okay, because we get cases like ingestion of pharmaceutical substances in imported medications, and the what do you call this? And the label is in foreign language. We cannot even understand, and it's hard. Okay, it's really hard. Okay. Now, this is the National Poison Management and Control Center in PGH. Okay. This is their direct line and the trunk line for Philippine General Hospital, and their cell phone number too. You can call them, and they will give you a better information on what to do. Okay. Now, I think let's move to opening our chat box. What do we have here? Okay. So, what if you have egg allergy? Don't give eggs. It's from Nicole. Don't give egg. Okay. Okay. Good morning, Doc. What other substitution for egg whites? It really depends on what kind of substance here. Sometimes a small amount of milk. Okay. We just have to make sure, because we don't actually recommend it, but others, it really depends actually. But if you don't have egg whites, the universal, what do you call this? To neutralize it, a small amount of milk. You can try that. Okay, just to have to make sure that the consciousness is not impaired. Like what I've said, if you give liquids to a patient with an impaired consciousness, it's more dangerous. What about termite pesticides? Oh, I love this pesticide, the termites. The termite pesticide, this question is coming from Christy Chan. Okay. The termite pesticide, or they call it termicides. Okay. It's the new one that's coming out right now, reformulated actually, is pyrethroids. Okay. So you can kill the termites. Okay. And if you're exposed to this, just like in any other pyrethroids, you have allergic reactions. Okay. Significant exposure, meaning probably ingestion or significant inhalation. You can trigger asthma, difficulty of breathing, palpitations, allergy, rash, etc. But for the old termicides, that is a totally different story. Okay. because for the old termicides and others, they still use it. They use organophosphates, and it's a very, very dangerous chemical. Don't even uh, don't use it at home, because it's part of your what you call this magnificent 12 or dangerous 13 or magnificent 12, meaning it's a persistent organic pollutant. Okay. Now, again, from Christy again, what if, where is that? What if there's arsenic for old pesticide? Arsenic is a heavy metal. Okay. Now, in other countries, I think arsenic is used to kill ants. You can buy it, actually. Now, it really depends on the amount of arsenic. Okay. Arsenic is known to cause cancer. Okay. In a small amount or small amount of exposure, there will be some manifestations though. Chronic exposure or long-term exposure. I can, I've seen cases like this. There will be some changes in the nails, skin changes, okay? But for a single large exposure, most cases, usually gastrointestinal sudden onset of explosive diarrhea, vomiting, weakness, etc. And sometimes they mistaken it as a simple gastroenteritis, but the picture, the clinical picture, or the manifestation doesn't fit. It's the patient looks more sick, okay, really sick, okay. Okay, I think we're done here. Doc, would you prefer, from Jennifer Malana, Doc, would you prefer water-based than the original pesticide? Actually, a very good question, actually. Now, the water-based, when you call water-based, when you say it's water-based, it's actually water-based, but it contains some degree, some alcohol too, okay? Now, if you notice, the water-based and the standard pesticides or insecticide spray, let's just say it's a spray, they contain the same chemical, except that the original has petroleum distillate, which when you spray gives you a warning sign that you don't need to enter the room. Okay, but for water-based, you can enter the room anytime. Okay, so here's the thing: do not spray your insecticide or your pesticide or your insecticide directly above your bed. Why? Because the residues will come down too, and it will be on your pillowcases or bed sheets, etc. And when you have a small kid or a baby and you put that baby in that bed, chances are that pesticide, that insecticide will be absorbed on the baby via their skin. Okay. Now, from KD, are expired medicine dangerous or poisonous? Look, this is actually hard to answer. Okay. If you notice, pharmaceutical companies specifically put an expiration date to their products. Okay. If you want to avoid untoward reactions or probably poisoning, we just have to follow what the manufacturer's recommendation. They spent millions, pharmaceutical companies spend millions of dollars in research and then production of their products. And they ended up, you know, they came up with recommendations for consumers to follow. If you don't follow, well, they are not pliable. The question there is, if it's poisonous, I cannot say. It can be poisonous, it cannot be. Probably others, no effect. But sometimes we hear this, 2 months pa lang na-expired, pwede pa yan, and everything. But are you that confident to take these expired medications? Okay. Questions really coming up. Okay. Next one. Okay, hold on. Good morning, Doc. From Mary Abigail Chan. Can the aerosolized insecticide like Baygon can be absorbed right through the skin? The answer is a big YES. Yes. Okay. So, what type of milk, Doc, in case there is no egg? Any milk from Lai Canonigo. Any milk will do. Small amount, okay? One question, Doc, from Jennifer Malana. Okay ba na kami na house 5 bili ng termicide at ibuhos dun sa area basta nakamas at aalis agad at nakasecured ang area? Kailan namin titignan? Mahirap kasing sagutin ang tanong mo. You know why? If you really want to get rid or gusto mong maubos ang termite or ang anay sa bahay mo, you need to go for the source. Hanapin mo kung saan nanggagaling. Okay? Kahit na nilagyan mo yan ng chemical, babalik at babalik yan kung hindi mo hinarangan, yung tinatawag nilang binabakuran ang pinanggagalingan. Look, ang mga bagong termicide kasi ngayon, dapat yan i-apply mo every 6 months to 1 year. Okay? So, magpapaulit-ulit ka. Pero kung gusto mo, at of course, ako naiintindihan ko na talagang magpa-termite control ngayon is napakamahal at gusto nyo lagyan yan, dapat kasi meron kang personal protective equipment at pagka tinimplahan mo yan, naka-gloves ka, ang gagamitin mong gloves, yung pang, what do you call this, panlaba, mahaba, hindi yung gloves na ginagamit na pang-opera. Tapos mag-mask ka, mag-face shield ka. Okay? And then balikan mo siya kinabukasan pag in-apply mo ng umaga. Okay? Now, from KD to everyone, same with Lysol. Don't spray above the bedding. Yes, because Lysol is ang active ingredient ng Lysol is called quaternary ammonium compounds. It's actually toxic. Okay? I think it's more toxic than the insecticide. Okay? Now, pag nag-spray ka sa doorknob ng Lysol, okay? Maghintay ka hanggang 10 minuto. After 10 minutes, punasan mo na siya ng basahan na may tubig. Basa. Para matanggal ang residue. Okay? Huwag niyong hayaang mag-stay doon. Just like ngayong panahon ng ating COVID. Okay? Maraming gumagamit ng disinfectant, antiseptic, sterilizer, sanitizers, etc. So, may mga nagtatanong sa akin kung paano paggamit ng mga ganyan, etc. So, ang tamang pag-disinfect, may stages kasi yan eh. Ang una, linis. Okay? You have to clean first. Linisin mo muna. Pagka matapos mo linisin, saka mo siya i-disinfect. After mo siyang i-disinfect, linisin mo ulit. Kasi kapag kayang tinatawag nilang, let's say, doorknob, ang tawag diyan is high-touch area. Okay? High-touch area. Doorknobs, yung mga doorknob sa banyo, sa pinto, etc. So kailangan, meron kasing tinatawag na contact time ang mga chemicals para mamatay ang mikrobyo, especially na kung iniisip natin makaiwas tayo sa COVID. Okay, for the bleach and Lysol, tama na 10 minutes, and then punasan nyo ulit, including also your dining table, your countertops, etc. Okay na yun. Okay. Actually, may lecture akong ganyan sa Philippine Pediatric Society on October 6, I guess, about these chemicals currently used in during COVID times. Okay, so I hope I answered all the questions, and thank you very much for the opportunity. Nasaan na ba tayo? Okay.
Yay!
Mas maganda ang light. Kasi ang light sa akin, pati yung lecture ko sa PBS na yan, gusto